we are just going to change the tube on this hearing aid. So you can see that what we've got is the part that goes into the ear. Now this is just a meatal plug, so it's not a very big earpiece. We've got the tube or the pipe that runs up, and then we've got the hearing aid here. So we're going to put a fresh tube on because about every 3 months, because it's sitting by the side of your face, it just goes a little bit hard and the sound doesn't travel through properly. So to do that, what we're going to do is we're going to take a little pair of just pliers and we're going to just gently pull that tubing out. Okay, so we've got the earpiece there, means we can give it a real thorough clean, and we're just going to detach gently the tubing there. Now, if the person is with you, you can measure up the tubing back onto their ear. Because they're not with me today, I'm going to show you how to just re-measure to the length of this. So I'm just going to pop this just there so it's safe. So we've got our earpiece and our hearing aid. So first things first, I would have, oops daisy, a few different little pieces of tubing. So tubing comes in different thicknesses, so it's worth making sure it's the right thickness for your earpiece. But the first thing you want to do is cut the tubing so that it goes to a tapered end. You can see like that. So I've always done that. I'll do another one. I've always done that by pressing my finger to one side, taking the scissors and just cutting into it, and gently, you'll feel a lot of resistance from the tube, cutting up the edge. Now some tubes are pre-cut. I would say to take care with the scissors. Obviously if you're not confident doing that, then get somebody to help you, but it's just making sure that this bit is thinner so that you can pull it through. So it's really important to make sure we remember which end's which. So that end is the bit that's going to go into the ear, and that's the bit we're poking the tube back through. And it's going into the hole at the top because the hole at the bottom is our vent. So we're going to start to feed that back through. Sometimes it will just pull through with our fingers. Sometimes we need a little bit of help from the pliers. And again, to stop the tubing snapping, what I often do is twist the pliers rather than just pull. So we're twisting the pliers just nice and gently. And we're doing that until the point where it just starts to pull upwards. I'm going to show you what too far looks like. So if you pulled it to there, then that's too far. It needs to be, so it's just going upwards, but there's a slight forward angle. And then we need to snip it again, so a little bit more fiddly scissor work. So again, being really careful with your fingers, I open the scissors and I pull the tube a little bit and then I let it bounce back. Because what we want is to make sure, as we do, so we can move that a little bit, we want to make sure that's nice and smooth and there's no pointy edges so it's not uncomfortable in your ear. So then I'm going to take the old piece of tubing and I'm going to put it next to it to that bend so that I can see that we are cutting there. Now if that's taken you a little while, you might do what I've done and just leave an extra millimetre or so that you can put it into the ear and just readjust it if you need to. So then you're going to put it back onto there. Okay. So it sits back like that. And my other top little tip is that sometimes when you've done it, the hearing aid can feel a bit bouncy behind the ear. And if that's the case, pull it to a right angle like that so that it pulls naturally really close behind the ear and it's less likely to pop off. So that is how you retube your hearing aid.